The ratio of potassium in the ICF compared to the ECF is a really important regulator of action potentials. Potassium is needed to repolarize the cells. It's needed to create iPSPs. We have too much potassium in the IF, depolarization, it's going to happen too often. With too little potassium in the IF, we get hyperpolarization. Cardiac muscle is particularly sensitive to hyperkalemia. It's that plateau phase of their action potentials. The other problem is that potassium is a regulator of pH in both the ICF and the IF. We expect to have a high amount of potassium cation in the ICF, and that's okay. But at abnormal concentrations, either high or abnormally low, either one, potassium cations start to get traded for hydrogen cations, and this creates acidosis in either the ICF or the IF. Your kidney prefers to secrete potassium, and it has a really hard time trying to save it. This is why potassium is so important in your diet. Potassium regulation is tied tightly to sodium regulation. Aldosterone ties those two together. Aldosterone causes the kidney to secrete more potassium, trading it for sodium. And it's those NAK pumps in the distal convoluted tubule that are doing this potassium management. Hyperkalemia occurs when blood potassium levels are too high. A common cause of this is kidney failure, as is in the case study that we have for the urinary chapter. The kidneys normally secrete excess potassium, that's like their default, and if the kidneys aren't working properly, potassium builds up in the blood and fills over into the urine, causing the urine potassium to go high. Another cause of this is crushing injuries. When large amounts of cells are damaged, all of the potassium in their ICF, or their intracellular fluids, it leaks out into the extracellular fluid. Opposite from sodium, excess potassium causes muscle weakness. With too much potassium in the interstitial fluids, potassium can't flow out of a neuron in repolarization. And this is especially bad for cardiac muscle fibers of the heart who want to create that plateau for their action potential. Hyperkalemia makes it possible for the heart to go into tetany, or sustained contractions. Some potential solutions to hyperkalemia is calcium gluconate to stabilize the heart, but then also fluids to lower that extracellular fluid concentration of potassium. Hypokalemia is when blood potassium levels are too low, which is not common. Our default is that we usually have too much of it. We have to secrete it, and then we have to eat it. One common cause of this that can happen very easily is vomiting or diarrhea. Each of those lead to a pretty significant potassium loss. And potassium loss can also occur with the overuse of diuretics, especially loop diuretics that act on the nephron loop and obligatory water reabsorption. What happens with hypokalemia is the opposite. You get muscle weakness or cramps. Depending on the severity of it, IV potassium replacement is usually preferred. But again, all of these things are band-aids until you find the source of the imbalance. Calcium is present in your plasma as the cation, but the cation is mainly stored as calcium phosphate salts in your bones. So recall from the endocrine section or from bones that calcium in the plasma is regulated by that parathyroid hormone, and PTH increases calcium in the plasma, right? And then there was the other antagonistic hormone of calcitonin that decreased the calcium in the plasma. So hypocalcemia increases the excitability of muscle cells, while hypercalcemia hypocalcemia does the opposite and inhibits action potentials in muscle cells and neurons. A classic cause of hyperparathyroidism or overactive thyroid glands is sometimes just an overactivity of those 4 parathyroid glands that are on the posterior aspect of the thyroid. Some cancers that can also release PTH-like substances that have the same effect. We didn't say this back then, but PTH is bones, stones, groans, and psychiatric overtones. There is bone pain from hyperparathyroidism. There are kidney stones, abdominal cramps or constipation, and confusion or depression. Again, IV fluids or diuretics to flush out the calcium can help, or bisphosphates, which are drugs that can help slow bone breakdown. In fact, you see those kinds of drugs being advertised as osteoporosis drugs. Another common cause of imbalance or hypocalcemia is hypoparathyroidism, right? And this can often happen after a thyroid surgery. By taking some of the thyroid organ, we may take parathyroid tissue with it. It can also result from a vitamin D deficiency. So remember, for you to absorb vitamin D, yes, you need sunlight, but you also need calcium. Calcium is kind of like the doorman. It's like someone who opens the door for vitamin D to have efficiency. There are some signs that can come with hypoparathyroidism. There's one sign that when your cheek is tapped, you'll get a facial twitch. And then there's another sign that gives you a carpal spasm when a blood pressure cuff is inflated, right? And hypoparathyroidism or hypocalcemia can be treated very simply with calcium supplements. However, at the same time, you also need to take vitamin D supplements.